Tonight, we are hearing firsthand the desperation Georgia families are facing. They are trying to find hospitals that offer a potentially life-saving treatment for COVID patients.
Today, Joe Hankey talked to the wives of two ICU patients, both telling him it's nearly impossible to find hospitals with available ECMO machines because resources are still so strained by this fourth wave of the virus. And Joe, I understand they've called dozens of hospitals here, but have been turned away every time. I think a lot of people are curious too what an ECMO machine is as well.
Absolutely, it's a unique machine, Sheba. The two wives I talked with, each of them tell me they desperately need to transfer their husbands to hospitals that can offer this treatment known as ECMO. Only certain hospitals offer it. Some are short on machines, while others don't have enough specialized staff to administer the treatment.
So I've actually not been able to see him since he went in on September 3rd. And that makes this excruciating for families.
And India Jones says she cannot imagine what her husband, 31-year-old Curtis Jones, is going through. Curtis began showing COVID symptoms on August 24th. Doctors at Wellstar, West Georgia and LaGrange admitted him on September 3rd, and he's spent the past 6 days on a ventilator. India says her husband is no longer considered COVID positive, but the virus led to pneumonia and severe lung damage. That is why his doctors believe he needs extracorporeal membrane oxygenation, or ECMO treatment.
It's used to help people whose lungs actually can't provide enough oxygen to the body, even when given extra oxygen, and that's the boat we're in.
The machine pumps and oxygenates the patient's blood. India says it would give Curtis's lungs time to rest and heal. While Curtis had a severe COVID infection, he is a rare exception. He was vaccinated. His doctors in India called dozens of hospitals across several states, searching for a hospital able to offer him ECMO treatment. But when we talked with her this morning, they had only hit dead ends.
I don't care if they tell me no 18 million times, I'm going to fight for my husband.
This afternoon, a hospital in Macon agreed to admit Curtis.
They've made it very clear that without ECMO treatment, Alex's chances of survival are slim to none.
Christina Cook's husband, Alex, is in Northside Hospital, Forsyth ICU. He is not vaccinated. August 30th, he started showing COVID symptoms, tested positive days later, and then began struggling to breathe. He went to the hospital on September 5th and has been in a medically induced coma since Sunday after he developed pneumonia and has not responded to any treatments.
We just need the world to know that we'll go to any length to get him what he needs.
Similar to Curtis, Alex is young and has not previously been diagnosed with any medical conditions, and his doctors and Christina have also called dozens of hospitals.
His physicians continue to stress that he is, in their words, the most perfect candidate they've seen thus far, and we cannot get a hospital to take him.
And Christina Cook there tells me her husband, Alex, was not anti-vaccine. He was for a time hesitant, then planned to get vaccinated, but simply had not yet been vaccinated before testing positive. She's being advised not too much more time can go by for her husband without ECMO treatment. India Jones says her husband is being transferred today to Macon, but that transfer, the trip, will be risky. Right now, she's just praying for the best possible outcome.